Welcome to Ortho Insider Season 2. This is the Canadian Orthopaedic Association's podcast that goes behind the scenes in orthopedic surgery in Canada. Today we have Dr. Peter MacDonald with us. He is the past president of the Canadian Orthopaedic Association as well as the American Shoulder and Elbow Society. And he is also the founder of the Pan Am Foundation in Winnipeg, Manitoba, where he works as a sports medicine orthopedic surgeon. He's also the team doctor for the Winnipeg Jets of the National Hockey League, as well as the Winnipeg Blue Bombers of the Canadian Football League. Welcome, Dr. MacDonald.
It's great to be here.
Yeah, thanks for being here. This is very exciting.
It is.
So, first of all, we ask everybody, I'd love to know, what is your origin story for orthopedics? How did you get into it?
Great question. As a lot of people who go into orthopedic surgery, I had some orthopedic injuries. In first year med school, I went on a ski trip, like at Christmas time, first year med school, fell on the slopes of Kimberley, BC, and ripped my ulnar collateral ligament.
Ulnar collateral ligament, that's up my alley.
And then kind of next year after that, I was playing, we had like the football team for the med school, and I was lucky enough to be the quarterback, but I dropped back, got sacked, and had a third-degree AC separation.
Oh.
So I started to get intrigued by all these orthopedic injuries. Plus my brother, and I had two brothers-in-law who were orthopedic surgeons, senior of course, and they kind of got me interested as well. So all that added together, I went and did an elective in third year med school in California, Stanford, in orthopedic surgery, and just came back knowing that I wanted to do it. I just loved it. It seems like it was so like black and white. I'm kind of a black and white person. You know, something's wrong, something's broken, you fix it, they get better, they're back on the field, whatever. So you see immediate results that make a difference to the patient and their families, and it's clean, not a lot of infections, unlike general surgery.
Yeah, totally.
and you just see changes in the life of the patient as a result of the work you do. So.
No, absolutely, I agree with that. And I think when we're hearing a lot of people get into orthopedics for those exact reasons, right? Especially the personal kind of injury reasons, which is awesome. Yeah. Sports has been a part of your life, it seems like, for a long time. And is that something that drew you into what you do now, in terms of the team doctor for the sports teams?
I always liked sports. I was kind of a sports fanatic. I was kind of a jack of all trades, master of none. I liked playing multiple different sports. I didn't like play, junior hockey or anything like that. But I enjoyed a lot of sports, and I was kind of a big sports fan, and it just kind of, connected with orthopedics. It seemed to be a natural thing to want to do that. And I also think, like, at the time when I was graduating, coming out of residency and going into fellowship, there was kind of a void for modern sport medicine techniques, modern at the time in Manitoba. So, it was kind of everything aligned, and it worked out. Got a great fellowship in London, Ontario with Pete Fowler, Rich Hawkins, Tony Miniacci. So they were like, especially Hawk and Fowler at the time were like world renowned. Mm-hmm. And so I just felt so lucky to work with these guys. They're like giants in the field.
Absolutely. I was going to ask you about that. I'm really glad you brought that up, because you had this opportunity to train in London with the giants, of orthopedic surgery, and what was that like, and what did that mean to you to be able to work with them?
Oh, it was unbelievable. Like, when I got the acceptance letter from Dr. Hawkins, he said, we're in the OR 2 days a week, we're in clinic 2 days a week, and we play golf on the 5th day.
Amazing.
So
that's awesome.
That sounded like perfect for me.
Yeah, absolutely. That's the classic orthopedic surgeon residency, right?
Yeah.
Or fellowship.
So, and I was so excited because, you look at London, Ontario University Hospital at the time, not only they had Hawk and Fowler, but they had C. Swearback, Bob Bourne, like world-renowned guys in arthroplasty. So all, like, as part of their group, it was unbelievable to have all these world-renowned people. And Dr. Drake in neurosurgery, the first one to clip an aneurysm, or one of the first ones. So, and patients flying in from all over the place, all over the world, to get service by these renowned surgeons. So it was amazing.
That is amazing. And did their mentorship lead you in a certain direction, like, for example, sports or anything else?
Hugely. Like, Pete Fowler was, he became AOSSM president. Mm-hmm. He was president of ISACOS as well. So, and he was so well respected around the world, and again, people coming in from all over the place to get his opinion, and so brutally honest with everybody, including the colorful language.
Interesting.
But
yeah.
and Hawk the same way,
Yeah.
more on the shoulder side. So, to work with those two guys, super special. Not only the stuff they taught me about orthopedics, but how to be a good, effective surgeon, mentor, family person, all those things. So.
Amazing. So they sound like really well balanced in individuals and surgeons.
I mean, they worked hard, right?
Yeah.
But they really placed a high value on the complete package, right? So
that's incredible because we just saw yesterday, Dr. Nick Matati getting his award, and going up there and seeing how fulfilled he was in terms of being so well balanced. That's not a side you often see of those surgeons, but he was up there with his family and everything.
Of course, Nick was a year ahead of me in London, so similar training.
Interesting.
Yeah, and when I went for my interview, Nick was in one room doing an ACL, and Pete Fowler was in the other doing a scope.
Cool.
And I watched Nick for a while, and then I walked across the hallway, watched Pete do a scope, and I was trying to make conversation, trying to impress him, of course, and I said, what's the history of this patient? And he goes, I don't effing know, just look at the chart.
That's awesome.
So I said, okay.
Now that's a classic orthopedic surgeon story. That's great. I mean, you touched on it a little bit, and you said those, Dr. Fowler, Dr. Kennedy, Dr. Miniaci taught you not just how to be a good technical surgeon, but how to balance everything.
Yeah.
And then what role did they play also in advocating for you? Because that's the other part of it, right?
Right.
Kind of put you into these leadership roles.
Oh, hugely. Like Hawk, for example, at the time, the American Shoulder and Elbow Surgeons had 110 members. And, we wrote up a paper together on release of the subscapularis in osteoarthritis. And it got accepted to the ASES closed meeting, which means the only members can go.
Okay.
But, and I said to Hawk, well, what is this closed meeting? How come only members can go? He goes, don't worry, I'll nominate you, you get in. And sure enough, he nominated me, and I got in a few years later, but it was unbelievable to walk into that room with those 110 people, Dr. Neer and, Cofield, all these guys, just around the room to sit down and have lunch with them. It was amazing, and so that wouldn't have happened without Hawk. And the same thing, carried along, he still has tremendous influence to this day. Without him, I wouldn't have been president of American Shoulder and Elbow, there's no doubt. So he his word, when he makes the phone calls and he says, this guy is somebody I want, they listen. So.
Interesting. So tell me more about that. You said that you wouldn't be president of the ASCS without the Hawk. So
I mean, he obviously encouraged me to aspire to higher things. He was a founding member and later a president. He was the first president from Canada. I was lucky enough to be the second, but he encouraged you along the way. He said, this is something that he thought you should do, and he'd always also go talk to your wife and tell her the importance of it. So he saw the big picture, right? Yeah. And we often joked at the meetings, his Hawk Fellows meeting, where incidentally over 150 to this day, over 150 of his former fellows come. He'll say a brief hi to you, and then he'll go and talk to your wife for 3 times as long.
No way.
He places a high value on family and partnership, and his thing up until very recently, he could stand in front of the room the first day of the meeting and introduce everybody without prompts.
Wow.
And tell them, this guy's from so and so. His wife's name is this, and his kids' name are this, and that.
Wow.
So amazing, right?
That is incredible.
Yeah.
That is like a
photographic memory.
And the mark of an incredible leader, really.
Yeah, well, and taking an interest as to where everybody is, what they're doing. It doesn't matter what type of practice they're in, whether it be community or academic. He takes an interest. So.
Oh, that's so awesome. And so has that kind of rubbed off on you because now you are one of our giants of our field, right? And you have many mentees. So how does that?
I mean, I try. My style's obviously different from Hawk. He's very gregarious. I tend to be less so. I don't remember names as well as he does, but no, I try and be there when the fellows need them for advice. Always a phone call away. A difficult case, taking an interest in what they're doing. helping them with references, making phone calls as needed. So I think that's really important. Like, fellowship is a journey, and it's only 1 year, sometimes even 6 months, but it's just the start.
Yeah.
It's, it's a lifelong thing.
Yeah.
I always think, once you have somebody serving a fellowship under you, they become your student for life.
Nice.
And I try and follow that rule. So.
Yeah, that's a great perspective. And then you've had such incredible leadership roles. COA past president, ASES past president. You founded the Pan Am Clinic Foundation. For young surgeons and young doctors who want to go down that path, how do we get started?
Well, obviously it doesn't happen overnight. I've had a long career now. I was lucky enough actually to get into administration very early on. Like, I was just back into practice, and they sat me down and said, "Do you want to be head of orthopedics in the hospital?" I was in St. Boniface Hospital, so I was only 32 years old. So I thought, well, I'm not a seasoned administrator, obviously, but I'll take a stab at it. And I kind of found it interesting, as long as, I always had a critical threshold where if I was going to more than the equivalent of 1 day a week of meetings, then that's too much. I want to be in the OR. I want to be treating patients. Yes. I want to be getting those satisfying and gratifying results. But I didn't mind going and going to meetings, trying to accomplish things, trying to move the ball forward for orthopedics in that hospital. And then later on, I became citywide head, university and regional health authority. I was 49 at the time, but still fairly young for that role. But so I got a fast start in life in that direction. Yeah. And then the other things just followed, like with the encouragement of Hawk and others, the COA and the presidency of the American Shoulder and Elbow. And then I became chair of this task force in Manitoba after COVID to try and get rid of COVID backlog. That kind of plopped on my desk one day. So that was a tough one, but we got through it, and I think we did some good. So, all these things kind of just, the stars kind of align, and you got to decide if it's the right time for you. And life is busy. You want to, keep that balance that we just talked about. Yeah. But by the same token, you want to do things that are exciting, they're challenging, things that you think you can make a difference with, and so I kind of followed that route.
Yeah. How do you keep that balance, especially with so many things going on?
Well, I don't always, as my wife reminds me, Sherry. But you try and, get home for dinner when you can. Actually, with COVID and Zoom meetings, I think it's been a blow for freedom for balance, because you can, have dinner with your family and then go do a Zoom meeting or whatever, as opposed to, not too long ago, we had to drive all over different hospitals in the city to go to meetings, and even academic meetings, some of them you can do remotely. So I think that that's been a good thing, to be able to do things remotely, to time manage, so you don't have to do travel time and stuff.
Totally. No, I agree with that completely. It'd be a big game changer. Right. You touched on being part of that task force, and you're instrumental in trying to clear that backlog in Manitoba, right, of after COVID. Can you compare and contrast the differences kind of pre and post COVID, and what are some of the challenges you foresee for us surgeons in terms of backlogs, advocacy, things like that moving forward?
Right. I think that orthopedics by nature, there's always going to be backlogs. You look across Canada, it's kind of part of our system, and we have to kind of work ways to keep those backlogs to a minimum. And I really believe that in the end, COVID highlighted the need for us to pay attention to backlog. So if it was a bad thing at the time, there's a silver lining to it, and then it highlighted the importance, and patients and the public in general do not tolerate backlogs beyond a certain point. They'll wait 6 months, they'll wait sometimes a year, but when it gets much further than that, then they get grumpy. So I think it highlighted the need to keep those wait times, we're at the benchmark, the CIHR benchmark, not only for arthroplasty, hip and knee, but for the other areas like sport medicine. So.
And so what can the individual surgeon, or even a team of surgeons locally in a community, do to advocate or enact that change?
I think you have to have patients on your side, because politicians will listen more to patients than the doctors. There's always a suspicion that the doctors are self-serving.
Yes.
And sometimes maybe they're right, but I like to think we aren't most of the time. But you have to listen to patients. So I think if you get a group of patients who are writing to their MLA or their member of parliament and saying, look, I'm waiting 2 years for my total hip, this is wrong. Yeah. And if you get, that critical number who keep highlighting it or getting in the newspaper and saying, this is a terrible story, I can't walk, I can't, go to the grocery store, and that my life is extremely challenged, then politicians will listen to that.
That's a really good tip, I think. So one of my mentors told me the same thing and said, hey, you have to get the patients on your side. And so as much as we can advocate for them in the hospitals, ultimately tell them to write letters, tell them to get, talk to their local politician and member of parliament or member of legislative assembly, anyone, because ultimately they have that power in numbers.
Right. Politicians do not like to be embarrassed. So they see a focus article in the paper of somebody who's in need, they feel embarrassed and they feel like they have to do something about it.
Yeah, so it's a wonderful, wonderful piece of advice, I think. And to a certain extent, I also find that takes the stress off of me, because I know I'm doing everything I can, but now we have to go this other avenue and we're working together.
Right. Yeah. I mean, the history of those patients who go public, even though it's hard for them to go public sometimes, is you usually get a phone call a few days later from the ministry or whatever. Awesome. What can we do to help this patient? Right?
Amazing. So it works.
It works.
Yeah, it's awesome.
It works,
It's nice. And like you said, orthopedic surgeons, we like those fast results. So that's excellent.
That's right.
Yeah, that's amazing. And tell me, we're looking at the the logo right there. So what does Canadian Orthopaedic Care Day mean to you, and what is the role of the Canadian Orthopaedic Association kind of moving forward?
Well, I think it's challenging times for all meetings because there's so many meetings out there. Like when I was a resident, there was the COA, the American Academy, and that was about it. Yeah. Now there's like meetings. You could go to a meeting every weekend if you wanted. And every year they keep popping up everywhere, and they're all good meetings, but it forces the practitioner to make choices. Yes. And we're in an era of ultra subspecialization, and if you're a hand surgeon, you don't want to go and listen to a spine paper usually. Totally. So it's challenging, but the COA is the only thing that bonds us together. Yeah. So we're always more powerful together than we are apart, and especially with lobbying with government, advocacy, I think it's really important that we have a strong COA. And also from a social networking point of view, I think it's important for us to, know each other, be able to talk to each other, have dinner together. We're stronger together.
Absolutely. Yeah. And you mentioned it earlier, kind of off camera, but the COA is our only national group.
It's our only national group. So if we fall apart and all the Canadian surgeons just start going to American meetings, that's not going to be helpful for Canadian orthopedics.
Absolutely, absolutely. Kind of on a related note, what are your thoughts on this brain drain? Is it a real thing? How do we entice people back in working?
Yeah, I think actually, it goes in ebbs and flows like everything. During the job crisis where there's too many grads and not enough jobs, and it's not there's not enough work, it's just we didn't balance the number of jobs versus the number of grads, and with government support. So some people were just forced to go to the U.S. Not wanting to go to the U.S., they were forced to, and I know a number of them, and it was kind of tragic because they wanted to stay in Canada. They're trained in Canada. They grew up in Canada. They have Canadian patriotism, nationalism, and they have to go to the States. Wow. And some of them, actually, a few have come back, but I think we always just have to realize there's going to be ebbs and flows. Yeah. We see the job crisis slowly correcting itself, and now when you post a job, actually, it's not automatic. You do get 50 applications. You're back down to getting 1 or 2. So now things are reversing themselves, but it'll go back and forth.
Yeah, no, for sure.
Yeah.
Changing gears a little bit, sports medicine has become a hugely popular field. At least that's my experience with our trainees. How did you get into your position? Being team physician for 2 professional sports teams.
Yeah, I think sport medicine is a great field for things we talked about, like the results. And you're actually, some people and surgeons tend to say sport medicine, it's easy surgery. It's like, it's like a country club. You go over there, scope a knee and whatever. It's not. It's like super hard to do well. Right. You can go and do it, mediocre and it's maybe easy. But if you want to do it well and you want to be state of the art, it is hard. And you have to be exacting. You have to, of course, have good relationship with patients. And these are young, like people in their 20s or whatever. They have a long life ahead of them. So if you don't get their joint, their knee or their shoulder or their ankle back into shape that they can perform, they may actually be not only jeopardized from not being able to play sports, but jeopardized in their lifestyle later in life. And they've got so many years ahead of them. So it's extremely important, I think, for us to provide good care for our athletes so they don't have lifelong disability after.
Absolutely. And as part of that, do you think it's good that we are now so ultra subspecialized that, you know, so-and-so can just only do the knee joint, for example, or even only a couple of surgeries in the knee?
Yeah, I mean, a strong believer, like if you do one thing a lot, you get better at it. And it's not only just the surgeon, it's the house staff, the nurses, even anesthesia. They learn what works and what doesn't. But I think you always have to have a bond between you and your group so that you are aware of what's going on in the other room, even though it's not something you do.
Yeah.
Wander in the room between cases and watch like a carpal tunnel or you know, a shoulder scope if you don't do shoulders. Just be aware of it, aware of the indications, be aware of the modern techniques. And that's why our sport medicine rounds are so critical, because it's not always cases that we're interested in, but we get to see what the other surgeons are doing. So it's critical.
Yes, it's kind of like a miniature version of having a big meeting and learning about new techniques, right?
Right,
yeah.
For sure.
And, you know, on the other hand, other side of that also, to your previous point about mentorship, you know, I'm a relatively new surgeon still, and when I started, one of the most calming and reassuring things was just one of my senior colleagues popping their head in and saying, "Hey, how's it going? Tell me what you're doing."
Yeah, no, that's my chief of surgery when I was a resident. Dr. Alan Downs used to do that. And he'd come in and he goes, "What are you doing?" And he'd watch, and he actually understood it.
Yeah.
And I always think the best anesthetists are the ones who actually are aware of technical aspects of what you're doing, because they understand the whole patient better.
Totally.
And what kind of anesthesia they need. So
yeah.
Some anesthetists maybe not so good. They, you know, give the anesthetic and they start, you know, working on their computer or their phone or their crossword puzzle. But the ones who are really good, they understand the operation, they understand everything about it, the indications.
Totally.
Yeah.
Yes. You talked about being exacting in the operating room with these sports procedures, and that's certainly the technical challenges of the job. Can you tell us a little bit about the challenges of managing all the personality in the professional sports world?
Right. I think, you know, people ask me why I cover so many Jet games. I go to about 75% of them. And part of it is so I learn the personalities of the player and they learn my personality. And it really gives you an advantage when you're treating them, because you not only are a doctor from an orthopedic surgery point of view or a general sport medicine point of view, but you have to be kind of an amateur psychologist, because they all come with different personalities. Some of them actually have, you know, disorders such as anxiety, things like that. And we now have like a psychiatrist at every game, just in case the players are feeling stressed out, they can go into a room after the game and talk to somebody professional.
That's incredible.
So I think that the psychology of sports is huge.
Yeah.
And it's not only just dealing with the athletes, dealing with their families. There may be family crises, health or whatever, and also dealing with their agents. And the more you get to know the agents and they get to trust you, the better chance they have. And nowadays we're in an era of second opinions and sending people elsewhere for surgery. The better chance you have of them staying in their home city and getting surgery.
Interesting. With
you or, you know, a member of your team. So
it's really about fostering those relationships.
It's all relationships, right?
Yeah.
So, you know, we had, I mean, they become almost like kids to you, you know, if they play for a long time, because you get to know everything about them, and it's actually rewarding, and you get kind of this bond with them and help them through, you know, their ups and downs of their career. So, like, I think we all underestimate the psychology of injury and how it causes like a minor depression with athletes, and how you deal with it in terms of their rehab and their recovery. So it's a big part of it.
That's incredible.
Yeah.
And so do you find there's a certain type of personality that's maybe, for the surgeon that is, that's best suited towards that job?
I think you have to be super open-minded, and you have to be understanding. You have to just listen, do a lot of listening. And also, you have to make sure that what you say is exactly the same as what other members of the medical team are saying, and the trainer. if you're, the worst thing is when the athletes get different messages from everybody. So it has to be consistent and constant. So.
Yeah, and so how do you maintain that messaging with the entire medical staff? Like, do you have regular meetings?
Yeah, that's a great point. Like, I talk to the trainer during the season just about every day, so we go over these things. And if I'm ever going to talk to a player, I'll touch base with the trainer, or if there's a consultant, I'll touch base with the consultant prior to going and talking to the player, because you want to get the message consistent. You don't want to confuse them.
It's almost like, when you get a referral and, the first point of contact doctor they've had tells you everything that's opposite of what you're about to tell them, and it's hard to kind of change that mindset, right?
Yeah, no, you don't want to have inconsistencies. And it's not all types of surgeries that I do. We have a lot of hand surgeries, so you have to touch base with the hand surgeon, the foot and ankle surgeon, and make sure the message is consistent. So.
And how do you manage if there's any sort of ulterior motives or things from other sources, like for example agents or family members, things like that?
Yeah, I mean, it's complicated. It's a complicated world. Sports is super complicated. You have to even understand their contract situation.
Oh wow.
Because like if they're in their last year of the contract, they're not going to want anything that's going to jeopardize their ability to get a contract the year after. So I think that's part of your homework that you do before you talk to the player, before you see them, to understand like the complete picture. And I think they appreciate that.
Well, that is incredibly intricate.
Yeah. It's different.
It's different. Yeah.
Yeah.
You mentioned your family and your wife Sherry. So what are some ways that you stay grounded and you're able to take time off and keep that balance?
Right. I think you have to have a partner who is very understanding, and somebody who understands what you do, but also understands the stresses and what you go through every day, and is kind of able to support you in whatever you do, but also like give you advice. Somebody who has a lot of common sense, which Sherry does, and somebody when your head's getting too swollen from ego to kind of say, come on.
Slow down here.
Yeah, I mean, I was fortunate to have a great partner. We've been married 40 years this year.
Amazing.
And then I have 3 kids, Lindsay, Carling, Duncan. Lindsay's a primary care sport medicine physician, Pan Am Clinic, so I get to work with her every day.
Amazing.
She even assists me sometimes.
Amazing. That must be very special.
And it's great.
Yeah.
And then Carling went to med school in Grenada and then decided to be a PA at the end of her med school. Didn't do a residency, but she's a PA on neurosurgery back in Winnipeg.
Awesome.
And Duncan's in the financial world, so
amazing.
Different path.
Very different path.
But very much needed in our family.
Yeah, fair enough. That's awesome.
Yeah.
As we kind of come to the end of the podcast, is there anything else that you'd like to share with us? Anything else that's going on with you professionally or personally?
I mean, there's always, I'm still working quite hard clinically, and we're still trying to support our research. We are looking for a couple of recruits in foot and ankle and in hips arthroscopy. I think we got the hip arthroscopy one covered, but and eventually in sport medicine too. So just keep an eye out on the COA job posting.
Amazing.
As we grow and expand. We're actually building a new Pan Am clinic downtown in Winnipeg as part of a big development. Amazing. With True North Real Estate Company. True North owns the Winnipeg Jets and are in the process of developing real estate around the arena and downtown. So that's super exciting. It'll take 3 years, but there'll be a new and expanded Pan Am with 6 operating rooms as opposed to 4 now. So
amazing.
That's exciting to work on.
Very exciting.
Project.
Congrats.
Yeah, thank you.
Yeah. And so if people want to get involved or things of that nature, how do they contact you?
Well, yeah, I'm always open to talk to any, especially younger people just starting out, try and give them advice. And please support the COA, please support the Canadian Orthopaedic Foundation. And if you're from Manitoba, support the Pan Am Clinic Foundation.
Absolutely.
Online. Yeah.
But support the Vancouver Canucks.
Yeah, maybe.
Dr. MacDonald, thank you again for your time.
Okay.
We really appreciate it.
Okay.
It was great chatting with you.
Yeah, great chatting with you.